welcome to the Deep Dive. Today we're digging into something really important but often, well, overlooked. The mental health side of pregnancy, specifically for women facing unplanned pregnancies and for unwed mothers. Our goal here is to sift through everything you've shared, pull out the key facts, the impacts, and look at the support that's out there. Really cut through the noise. And honestly, some of this might surprise you. So when we think about pregnancy, yeah, joy often springs to mind, but what's the real picture when it comes to mental health? The data you've brought paints, well, maybe a more complicated story.
It absolutely does. The research shows nearly 1 in 3 pregnant women actually struggle with depression. And get this, over 1 in 3 deal with significant anxiety at some point. Here's a really stark point. If the pregnancy wasn't planned, the risk of depression jumps. We're talking 2.5 times more likely to have depressive symptoms right through the pregnancy and for the whole first year postpartum. That's a big deal.
You know, when I hear unplanned pregnancies, my first thought often goes to teenagers. Is that fair? Or are we missing something bigger?
That's such a common thought, but yeah, it's a misconception. The data is really clear. This isn't just an age thing. For unwed mothers of any age, 20s, 30s, 40s, whatever, about half experience depression. And significant numbers also face things like bipolar disorder or just a persistent low mood. It's a reality for single mothers, period.
Wow, okay. Hearing those numbers, you immediately think, why? What specific things are making it so much harder for single mothers or those with unplanned pregnancies? This sounds like a perfect storm.
It really can be. There are a few key things that stand out from the sources we looked at. First, there's the whole disruption of life plans, career goals, education, personal dreams. Suddenly everything's up in the air and needs to change drastically. Then the financial strain, it's huge. Worrying about affording prenatal care, just basic living costs, and then childcare down the line. It adds enormous pressure.
And that's even before considering social factors.
Exactly. Social stigma is still a powerful force, that fear of judgment, maybe discrimination, or even family rejection. And importantly, this happens regardless of how old or mature the mother is. And finally, isolation. That's a big one. Trying to manage pregnancy, then early motherhood, often without a partner's support, sometimes living alone or, even in shelters.
That is just a tremendous amount to carry. So how do all these pressures actually affect the mother and, well, the baby? What are the consequences we see?
The impact is definitely significant for both. For the mother herself, there's a higher risk of complications during the pregnancy and birth. Also, sometimes increased substance use, and in really severe situations, thoughts of self-harm. And for the baby, there's an increased chance of being born preterm, having a low birth weight, and maybe more difficulties with feeding or sleeping early on.
And long term.
Looking further out, the children might face more challenges with emotional regulation and just general development. It's also worth pointing out that this heightened distress for single mothers and those with unplanned pregnancies can linger, sometimes for up to 5 years after birth, although the worst symptoms usually do get better over time.
5 years. That's a long shadow. It really highlights how crucial support is right from the start, doesn't it?
Yeah.
So this brings up a really important question. How can someone spot the signs? And maybe more critically, what kind of help is actually out there? What works?
Knowing the signs is key. We're talking about things like persistent sadness, feeling hopeless, or constant anxiety. Also, sleep problems beyond what's typical in pregnancy, losing interest in things you used to enjoy, overwhelming guilt, and crucially, any thoughts about harming oneself or the baby that needs immediate attention.
Okay. And the support options?
There are effective ones. Routine mental health screening during prenatal checkups is a great start. Therapy can be incredibly helpful, things like CBT, cognitive behavioral therapy, which helps change negative thinking patterns, or IPT, interpersonal therapy, which focuses on relationships. Safe antidepressants are also an option when a doctor thinks it's needed. And peer support groups or hotlines, especially those designed for single or unplanned mothers, can be invaluable. Just connecting with others who get it.
What's really striking, and I don't think many people realize this, is that mental health issues are actually the most common complication of pregnancy. More common than gestational diabetes or high blood pressure.
That's exactly right. It really puts it into perspective, doesn't it?
It absolutely does.
But, and this is important, recovery is definitely possible, especially if you get help early on. What seems to help the most, based on the research you provided, is getting non-judgmental care from doctors and nurses, people who really listen. Practical help is also huge support with housing, childcare, maybe education or finances, and of course, strong emotional support from family, friends, and those peer groups we mentioned. That network matters.
So here's something to leave you with. Remember, No matter your age or your specific situation, you absolutely deserve compassionate care. If you're struggling or you know someone who is, reaching out is so important. Talking to your doctor, finding a mental health professional, even just confiding in a trusted friend that's not weakness, it's a sign of strength. And it helps both you and your baby. You really are not alone on this journey.